Phimosis is the inability to retract foreskin completely up to the level of glans. So if that foreskin is not completely retractable, then it is called as phimosis or tight foreskin. That is physiological, I mean that is common in those young boys who are less than 5 years of age. That is called as congenital variety. If patient develops repeated sexually transmitted infection or balanopostitis, that is infection of the glands and foreskin, then also that elasticity of the foreskin gets affected and they develop a tight foreskin. Another cause for tight foreskin, that is phimosis, can be due to diabetes. We see so many patients who are having diabetes and high sugar level. They get fungal infection over the foreskin and glands, and that can lead to phimosis. Another cause for phimosis can be some cancer or affecting the glans, penis, or foreskin. In that case, the foreskin becomes tight and you are not able to pull it back completely. In those cases also, you develop a tight foreskin. Sometimes if patient is not having a proper hygiene, I mean they are not retracting it completely and not clearing all the smegma and dirts between the glans and foreskin, then over the period of time, that foreskins, because of repeated infection and poor hygiene, gets tight and you develop a phimosis. The routine physical examination by a urologist or a surgeon is sufficient to diagnose this tight foreskin problem. Also, it is sometimes mostly patients come to us with a self-diagnosis. They are not able to pull the foreskin completely. Mostly those are sexually active males who are facing discomfort while having sexual intercourse. Sometimes if the foreskin is very tight, then foreskin gets torn and you tend to develop a bleeding from the foreskin because there is a frenular artery between the glans and foreskin. If excessive force is applied in this tight foreskin, then it gets torn and patients usually develop bleeding while having sexual intercourse. Either self-examination or physical examination is sufficient to diagnose the tight foreskin problem. But if we are suspecting diabetes, then we ask them to get a sugar test done, and if the sugar is elevated and if we see a classical fungal infection over the glands and foreskin, then in those cases we ask them to get a sugar test. But for the tight foreskin problem, only self-examination as well as physical examination is sufficient. First treatment is the manual stretching of the foreskin. We ask patient to stretch it gradually and with sufficient pressure so that the foreskin doesn't get torn. Second option can be due to we ask them to apply some sort of steroid ointment or some sort of lubrication if they are complaining foreskin problem while having sexual intercourse. That also we advise. And if the foreskin is very much infected or patient is having repeated balanopostitis or they are having extreme difficulty in sexual intercourse or there is difficulty in passing urine. Sometimes if the phimosis is complete, like grade 4, grade 5 phimosis, you are not able to see the opening of the penis. In those cases, patients have difficulty in passing urine. The urine gets accumulated between the glands and foreskin, and in those cases, we advise them circumcision. Complication of tight foreskin can be they have a difficulty in having sexual intercourse. That is the most common. That frenular artery can get damaged and that can cause some sort of bleeding. If patient is not able to maintain hygiene, they are at more chance of developing sexually transmitted disorders like HIV, herpes, gonorrhea, chlamydia. These are more common in those who are having phimosis and tight foreskin problem. If improper hygiene is maintained for a prolonged period of time, then after 40 to 50 years of age, there are a high chance of developing a penile cancer also. But if circumcision is done at a proper time, then those chances of developing this all sort of complications are reduced. Also, the chances of developing sexually transmitted diseases like HIV, herpes, syphilis, gonorrhea are reduced by approximately 95% in those male who are circumcised. If due to tight foreskin, they are not able to perform a sexual intercourse, then it can affect fertility definitely. We have seen some patients who are not able to engage in sexual activity because that foreskin is so tight, they develop a lot of pain while engaging in sexual activity, and that pain can cause erectile dysfunction. So that is common. Also, those who are having tight foreskin and infection, they are at high chance of developing this premature ejaculation problem. Because of infection, the glands and foreskin becomes very sensitive, and that they are not able to sustain erection for a prolonged period, and they tend to ejaculate early. We have seen that after doing circumcision, their intravaginal latency time, that is time after entering the vagina until the person ejaculates, that is increased by approximately 2 to 3 minutes. So, treating tight foreskin also helps in increasing the ejaculation time. If hygiene is not maintained, there is lot of dirt accumulated between glands and foreskin, then they are also at high risk of developing cancer of penis after the 40 years of age. So this sort of problems are very common in those who are having tight foreskin, and it can be easily treated and managed wonderfully if they consult urologist at early stage of the problem and gets the treatment done for tight foreskin. What we see in our clinical practice is that tight foreskin problem is very common. Mostly young male are afraid to, or they have some hesitancy in discussing this problem with their partner or with the doctors. My sincere advice is to them is to visit the doctor, get their all doubts cleared, whether the skin is tight or not, or whether any problem in they are facing any problem with the sexual intercourse. Then they should consult either urologist or andrologist for this sort of problem. They will guide you in solving all your queries. If you require some sort of treatment, then andrologist or urologist is the proper person to guide you in this sort of matter.